Hi, good morning. This Sam again. I want to finish up with the second part of this video about surgeries, joint replacements. In particular, I want to talk about my bilateral shoulder replacement. On the last video, I talked about my total hip replacement on both sides. I didn't want to make one video for too long, so I'm breaking this into two different parts. So, um, long story short, I had two hips replaced as well as two shoulder replaced due to the damage from the arthritis, the autoimmune disease, and the ankylosing spondylitis. Yeah, I had gone through quite a bit. So anyway, I want to talk about what I had gone through, uh, uh, the recovery period, and what to expect, all that stuff. So anyway, let's get the disclaimer out. Again, I am not a doctor nor a medical professional or in any sort of medical school. So everything that I talked about are strictly medical experience of my own, um, medical issues that I've gone through, surgical surgery that I have, and it's been performed on me, and medication that's been used on me. So if you have any medical concerns, medical questions, please refer that to your doctor for opinion and advice. Thank you. So anyway, um, about maybe 15 years ago, I had both shoulders replaced, one by one at a time. Of course, you can't do this at the same time. So what happened is that, so if you look at this picture here, basically what happened is the disease just basically ate up all of my white bones, the cartilage. So it really hurts when I'm moving my hand. Um, I could not get the hand up to shoulder level. It's only more like 40, 45 degrees to the lower, uh, to my body. That's pretty much it. Any further up, it hurts tremendously on both sides. But one progress faster than the other. So ultimately, doing within a year period, I had to get both done, and actually it came pretty fast. Prior to that, my arm functionality was good. The pain management was fine, but within like a year or two, as it progressed, it starts hurting more and more and more, and really quick, it just kind of got damaged to the point that I just had to get it done. And I am on biologics at the time. Also taking other painkillers just to take the edges off. And that really did not stop the progression. It only slowed it down. I'll talk about biologics on and all other medications on a different video because that would take quite a bit as well, as I have gone through quite a bit of the medication. So anyway, back to the replacement. Um, the Here are the materials. There's two different types of replacement. This is the normal. This one is the normal, and this is the reverse. The reverse, the ball is on the. It's mounted to the body. The insert with the cup, uh, it goes into the stem of the bone. Um, the normal replacement is they put the cup uh, on the shoulder, and then the insert, the ball part goes into inside of your bone of the arm. And I had both. I have two different types. So, and here's an X-ray, just an X-ray that recently it's been done a couple weeks ago. There's the normal insert, and that's the cup mounted to the shoulder, and the insert is the cup. That's the insert into the bone. That's on my right side. Here's the left side, and this is where the ball is mounted to the show to the actual body, and then the insert with the cup is down here. So there's two different shoulder replacement that's used on me. I don't know why my doctor did that, but he said we'll do a reverse um, shoulder replacement on the other arm. And I said, okay, well, whatever you think is right. So now there are some differences. Um, the range of motion between the two, from my experience, is different. The regular replacement, the range of motion, the hands going forward, I can bring it up higher. Um, the reverse uh, replacement, I can bring my hands going backward a little bit further. So, not sure why, but that is how I am um, working with right now. That's how I'm my range of motion is right now. And honestly, the replacement did not completely fix my range of motion. You know, I can just kind of bring it up to about this much. Not anymore. There's probably a lot of factors to that. Maybe the body is stiff. Of course, I don't have those, um, you know, acrobatic bodies with that kind of flexibility. But then again, technically, I thought I would be able to, at least reach up to um, 180 degree in line with the body, but no, neither one of them can. But at least I can move my arms, as I wanted to, and I can do some exercise, do some work, do some whatever things that you want to do. Just a little bit harder, a little bit takes a little more effort, not like anybody else. So it's still, it's still a very good procedure. Um, here's the cut. The normal the normal surgery, the cut did not seem to be so large, but then the reverse is much longer, much longer. And from what I was reading, the reverse replacement is more complex. So it probably is. My There's a little bit of effect to me to that. Maybe it's because this is too long, and it's probably cut into a little bit of my nerves. Um, I realized when after the surgery, my pinky and half of my index finger, going down all the way down to the bottom half of my arm here, um, I cannot sense anything. So there are some sensory nerve damage, probably due to this surgery here. It's gotten a lot better. Yeah, it's gotten almost 90% better. I'm still feeling a little bit of a tingling here, but still, there's nothing wrong on this side, just on my left side. So that was the disadvantage part, probably due to the surgery. So again, the advantage and the disadvantage is a whole lot when I have my arms at stake that I couldn't be moving up and down anymore. I couldn't lift anything. Um, so really for me, it's just a no-brainer. And the medication, again, the medication only slows down the progression of the disease. It doesn't really stop it. So ultimately, it's still gonna eat up all of my bones. So it was a no brainer for me. So I just had to get it done one by one. It's still 1 year apart, just like my hips did. And what I was expecting, what to expect was the hospital stay was a week. In general, if your recovery goes well, my recovery for the for the shoulders went pretty well. The hips, I had a little bit of complication uh, from the other video. The surgery took about 46 hours. Again, same kind of process time as the hip, 46 hours. And after surgery, ICU, then move you over to the regular rooms, and then the nurse will get you up and going really quick and trying to get you moving. Um, Medications with IVs and antibiotics, those are normal. Pain medications. To my surprise, actually, this has actually surprised me more than anybody. To my surprise, I only used pain medication once on both shoulders, once inside the ICU when I probably just got out of surgery, and the anesthesia starts wearing out. I start feeling some pain. I asked the nurse to give me one shot of, I believe it's either morphine or oxycodone. That's what they use in the hospital. Only one shot. And the rest of the time, um, it was ice bags. So had them put a lot of ice in a bag and just put the ice on top of the cut, and that took away all of my pain, and it probably actually healed a little quicker because ice does reduce inflammations. When you fall, nowadays when kids fall, you go home and put an ice pack on it, right? It's the same. So I was putting a lot of ice on it for the few days I was in the hospital, basically just ice. And when I got discharged at home, I still use ice packs at home, and have not taken any painkillers for the surgery itself. So yeah, at least that part is good. Painkillers is really not good for you. So thereafter, it's just you know therapy, a lot of therapy. And here's the on the this red pamphlet here is pretty much the same as what I talked about. What to expect, how long you're gonna be, and what do you need to do. So within the few months, um, my arms will be on a sling, just kind of hanging there. And when I do therapy, I'll be using the other hand, the other good hand, to guide this thing to move. The first week, uh, they don't want you to move your arms at all. And on the right side here, um, these are the therapy stuff that actually I needed, and it helped. The pulley, you sit that on the door, and you're gonna pull your arms. When the arm can move, you're gonna pull the arms up slowly, and just the range of motion. So you gotta move that. The rubber band is to help with the string, pulling in and out, however therapist wants you to do that. And lightweight dumbbells works well to give you a good strength. So, again, these are the time frames. Flexing your muscle on week 2, light therapies on week 3, and so on. The 4th week, a lot more movement. Take the arms out of the sling and start moving it little by little. Can't carry heavy stuff, of course. So, 5 to 8, keep on improving the arms. And from there, it's just more of a physical therapy recovery. Follow up with the doctors, took more X-rays, make sure nothing is broken, no infections, nothing unexpected can happen. So those are just follow ups. So everything went well. From there, it's just like the whole recovery time, from surgery to feeling like it was never been in surgery. I say a good 4 to 6 months is when I'm actually feeling like, oh, this is not feeling like a brand new shoulder, but more like a normal shoulder now. So, you can do plenty of stuff. I still wouldn't carry super heavy stuff, and because not just because of my shoulder, my spine, with the ankylosing spondylitis, fully fused spine, you won't. I can't carry heavy stuff anyway. Light exercise is always good to get everything moving, all your movements, and loosen up your muscles and everything. Oh yes, if you want to see that pamphlet, um, I want to put this link, and you can look at it to see the whole procedure process. It's really almost the same as what I mentioned. Being in a hospital, how many days, and be on a sling and everything else. So it's probably a little more descriptive than what I have said. I'll put the link on the description. So, also, I want to mention the doctors that perform my hip has been retired, um, and the orthopedic who did the surgery on my shoulder is a different one. But they do belong in the same group, and that group is an excellent group of orthopedics in there. So, the key of finding a great doctor, and how well your surgery is going to go, it's very important. So make sure, if you are planning to have a surgery, make sure you do get a good doctor, and it really makes a big difference. So I don't know how many planning to. I don't hope anybody have to go through what I have been through. Hopefully, medication would be enough for you. But um, if you must go through the process of surgery, find a good doctor, find a good group, find a good hospital. Um, that will really help a lot. So again, the damage has been done with the arthritis and the ankylosing spondylitis, autoimmune disease. It is very, very bad. It's still progressing in my body, and I don't know where it's going to go. Actually, I know where it's going to go. I'll have a video on the next one. Next one, I'm probably going to talk about something that I have a little neck compression. That will be the next video. It's something that's new, and it's pretty bad. So. But anyway, that's all for this particular video on the shoulder surgery. Hopefully, if anybody else needs to go through it, good luck. Find a good doctor. Again, find a good doctor. A lot of therapy. Make sure once you're done with the surgery, do a lot of therapies to help your hand, your arms, and everything else get moving, get recover much sooner. So again, that's all for the video for right now. This is all covering the shoulder surgery. So that's all for this particular video. Thank you for watching. I'll see you next time. If you like the video, please give me a like. It will help out with the algorithm. Uh, and if you want to subscribe, I'll have more medical videos coming up on all my journeys to hopefully find a better days. Everybody, to help everybody find a better days, as well as me and you guys. If you have anything else to share with me, how you handle your procedures and your recovery, please do leave me a message below. Thank you so much. Have a good day. Bye bye.